Hello, my name is Martin Burrano, and I'm the Pharmacy Director at Independent Health. And actually, prior to coming to Independent Health, I was the Pharmacy Manager at Wegmans Pharmacy. I practiced community pharmacy for over 10 years, and I've been working at Independent Health for 10 years as well. I was asked to reflect on Chapter 9 of The Good Pharmacist, and just wanted to provide some feedback and reflect on my experiences as they relate to the topic in the chapter. And I feel that a pharmacist is in a very unique position in the community due to their easy accessibility to patients to share their knowledge, empathy, and compassion on a daily basis. And it's very important to keep that in the forefront of your mind when you're dealing with patients. Many of them are ill, family members are ill, so they need to be treated with a high degree of respect. And in order to do that, the pharmacist is uniquely positioned to serve the health needs of the community. But it is very important that the pharmacist is practicing at what they might refer to as the top of his license, his or her license, and really performing those responsibilities that only a pharmacist can perform in your practice, and reserving those non-essential or non-clinical functions to your support staff. And so efficiency in the pharmacy is extremely important. Everybody understanding their roles and responsibilities within the pharmacy department, regardless of whether you practice in the hospital community, even in a managed care setting as I do. You want to be able to use your knowledge, convey that knowledge, convey your support for your patients, be able to perform medication therapy management services, and so in order to have the time to do that, you need to basically ensure that the support staff is providing those ancillary functions, the basic product-oriented functions, in order to free up the pharmacist. And we've seen that in the community pharmacy. We see a number of pharmacies now luckily being able to provide the resources to the pharmacy department in order to be able to provide those cognitive services that you are uniquely positioned to provide. And going a step further, it's going to be important for us with healthcare reform in the future. As we move into healthcare reform, it's going to be very important. The pharmacist is going to play a critical role, I think, and because of the easy accessibility for patients. And in doing so, it's going to be important for the pharmacist or pharmacy in general to be able to measure the outcomes that the pharmacist can make in medication therapy management. And we're really going to have to develop that kind of quickly, so that pharmacists can show their value, not just anecdotally, not just in dealing with the patients, but be able to measure those outcomes from things like medication therapy management, adherence programs, safety programs, and whatnot. So that's basically the information that I got, that I was able to discern from the chapter, and taking that information and reflecting on my practice and my job responsibilities in the community and in managed care. I mean, we are strategically positioned, even in managed care now, to really have a strong influence in how pharmacy is practiced, and encouraging through partnership programs with pharmacies to encourage or find ways to reimburse for those services that are of critical importance in the areas of medication therapy management. So it's really going to be a partnership. A good pharmacist is one that can take his vision and strategically take that vision into implementation. And that vision involves the things I've been referring to in developing the right atmosphere, the right environment, so that you can practice the profession at the top of your license. Being able to perform those medication therapy management, developing those skills and performing those functions, and then documenting those functions and showing outcomes, so that the reimbursement is there, so you can continue to build on those programs in the future. So thank you very much for your time. Appreciate it.